Older adults often pay close attention to their heart health, blood pressure, and blood sugar levels, but they may pay less attention to small changes on the skin. However, a small bump on the skin may be sending a subtle signal that should not be ignored. Why do older adults often overlook unusual bumps on the skin? The first reason is that these bumps often look familiar. A red bump on the face, a small swollen spot on the neck, a scaly patch on the hand, or a blister on the back. Many people may think it is probably just a pimple, an allergy, dry weather, or skin just looks like this with age. Another reason is that older adults are often reluctant to seek medical attention for issues they consider minor. In addition, aging skin often already has brown spots, raised lesions, wrinkles, dry areas, or areas of discoloration. Because the skin has already changed over time, a newly developed abnormal bump may easily blend in with older signs. For people with diabetes, the issue is even more important. Some individuals may have reduced sensation of pain, itching, or burning. When the skin no longer feels sensations as clearly as before, a small lesion may remain unnoticed for a long time. Common types of pimple-like bumps. 1. True acne in adulthood. In fact, acne can still occur even in the 40 seconds, 50 seconds, or after menopause. It may be related to hormonal changes, stress, medications being used, cosmetics, overly heavy moisturizers, or unsuitable skincare products. Acne may appear on the chin, jawline, neck, back, or chest. Common signs include red bumps, whiteheads, or mild inflammatory pimples. The harm often comes from squeezing, picking, or using overly strong treatments, which can cause thin skin to become scratched, infected, or slow to heal. 2. Rosacea, facial redness with acne-like bumps. This condition usually appears on the face, especially on the cheeks, nose, forehead, and chin. People with rosacea may notice that their face looks redder than usual, flushes easily, feels sensitive, has mild burning, shows visible small blood vessels, and develops red bumps or pus-filled bumps that look like acne. If rosacea is mistaken for acne and treated with strong acne creams, exfoliants, alcohol, or drying products, the redness and burning may become worse. Long-term rosacea can make the skin more sensitive, cause more frequent facial redness, and affect confidence and daily life. In some cases, there may also be eye symptoms such as dryness, redness, or a gritty sensation, which should be evaluated. 3. Shingles, painful blisters on one side of the body. Shingles may begin with pain, burning, tingling, itching, numbness, or warmth in one area of the skin. Small blisters then appear in clusters, or in a band-like pattern. An important feature is that shingles usually appears on only one side of the body. Shingles can cause significant pain and may make older adults feel tired and lose sleep. The most common complication is long-lasting nerve pain after shingles, known as postherpetic neuralgia, which may continue long after the skin has healed. If shingles appears near the eyes, it can cause serious eye complications, so it should be evaluated by a doctor promptly. 4. Folliculitis, or skin infection. This condition can appear in areas with frequent friction, areas that sweat, areas covered by tight clothing, shaved areas, or areas where the skin has been scratched. The bump may be red, painful, swollen, contain pus, and the surrounding skin may feel warmer or become more red. If the infection becomes more severe, there may be drainage, an unusual odor, fever, fatigue, or spreading redness around the area. If the area is squeezed, picked, or scratched, bacteria may spread deeper into the skin and make the inflammation worse. In people with diabetes, poor circulation, or a weakened immune system, skin infections may heal slowly and spread more easily. A small pus-filled bump, if handled incorrectly, may become a larger infection that requires medical treatment. 5. A sore or skin cancer that looks like a pimple that does not heal. This is the part that should be heard carefully. Some serious skin lesions may initially look like a small pimple, a small lump, a scaly patch, or a mild sore. Because it does not look very alarming, many people keep applying cream, covering it, and waiting for it to heal on its own. However, if a pimple does not heal after several weeks, keeps bleeding, forms a scab and peels off, partially heals, and then opens again, or continues to grow over time, it should be taken seriously. If it is a precancerous lesion or skin cancer, delaying evaluation may allow the lesion to grow wider, invade deeper, or require more complex treatment. Not every non-healing bump is skin cancer, but a bump that remains unhealed for long enough should no longer be treated as an ordinary pimple. The safest approach is to have it checked by a doctor or dermatologist. Who needs to be especially careful? If you are over 60, you should observe your skin more regularly. If you have diabetes, pay closer attention to any wound, especially on the feet, between the toes, and on the heels. If you have a weakened immune system, are being treated for a chronic disease, have had skin cancer before, or have had many years of sun exposure, you should also pay attention to newly appearing bumps. People with very dry skin that cracks or scratches easily should also be careful, because even a small crack can become an entry point for bacteria. People who live alone should develop the habit of checking their skin with a mirror or asking a family member to help examine areas that are difficult to see. In older adults, covered areas of the skin are often where problems quietly persist the longest. Common mistakes. One common mistake is squeezing or picking at a pimple-like bump. When the skin is already thin and slow to heal, picking can turn a small area into an actual wound. The second mistake is applying old medication or medication that belongs to someone else. Not every bump is the same. Using the wrong treatment may mask symptoms, thin the skin, cause irritation, or prolong the problem. The third mistake is using alcohol or hydrogen peroxide too often. For aging skin, these substances may make the skin drier, more irritated, and slower to heal if used repeatedly inappropriately. The fourth mistake is thinking, if it does not hurt, it is fine. This is especially untrue for people with diabetes or reduced skin sensation. A painless wound may still be infected or slow to heal. The fifth mistake is covering it and then forgetting about it. An adhesive bandage may be useful for a short time, but if it is left on for many days without checking the area, the skin underneath may become moist, irritated, or infected. The final mistake is staying silent. Many older adults do not tell their children, family members, or doctors because they are afraid of being a burden. But an early question may help prevent a bigger problem later. What should older adults do when they notice an unusual bump? First, observe it. Look at where the bump is located, what color it is, and approximately how large it is. Notice whether it is painful, itchy, burning, or warm. One very simple but helpful step is to take a photo with a phone for comparison. Do not squeeze it. Do not pick it. Do not scratch it aggressively. If the area is dirty, it can be cleaned gently and kept clean and dry. Avoid applying multiple creams at the same time when you do not yet know what it is. If the bump does not heal after several weeks, or if you have diabetes or a weakened immune system, contact a doctor. Aging does not only require attention to the heart, blood pressure, blood sugar, or joints. The skin is also a small map of health. Sometimes, the body does not shout through severe pain. It sends a small signal on the skin, waiting for us to look more closely. I'm Monica Bellamy. Follow me to stay updated with useful health information.